Is there more to abutment design than what you can see? So in this episode of Bites, we're going to talk about the subgingival profile, the subemergence profile of the restoration. Historically, we didn't pay as much attention to abutment design. We used to flare the abutments out from the actual implant and, in a way, compress the soft tissue. The peri-implant tissues are much like this balloon full of water. When you place pressure on this soft tissue, that soft tissue can be displaced to another position. So we can influence our soft tissue by our implant restoration contours. Sue in 2010 describes the contours of the restoration as a subcritical contour and the critical contour. The critical contour is the contour around the gingival margin, around your restoration, while the subcritical is apical to that gingival margin. And influencing this critical contour and subcritical contour changes how the soft tissue can appear. So if you over contour the restoration, so here you can see when you over contour the restoration, you'll see that the soft tissue will often creep up. So you'll have some apical migration of the gingival margin. So you can actually cause some of the gingival recession around your implant by over contouring the restoration. We know that we want to have this submergence profile to be concave in nature. We don't want to compress the soft tissue. We want to have maximum thickness and stability. So you can see the subcritical contour is more concave in nature, whereas the critical contour is still supporting that gingival margin. So this facial critical contour, we can even make that margin deficient. We can actually underdimension the critical contour to allow coronal migration of the gingival margin. So if you over contour, you'd cause some recession. Conversely, if you slightly under contour your restoration, you may even be able to get some coronal creep of the soft tissue and have some coronal positioning of that gingival margin. So it's a very useful technique in those cases where you need a little bit more of that gingival margin. So you can see in this case here, this was a tooth that had to be extracted due to external resorption, and an implant was placed and a provisional crown was used as an immediate approach. And you can see by under contouring that provisional on the left hand side and then healing after 3 weeks, you've seen a coronal migration of that gingival margin. You actually haven't seen loss of the gingival margin. Oftentimes when you place an implant, you've extracted the tooth, you place an implant, you'll see some at least 0.6 to 1 millimeter of mid-labial gingival margin recession. So in this case, you can see some coronal migration by slightly under contouring the restoration. Now, what about the papilla? The papilla, we can even squeeze that papilla to attain a slight increase in height of the papilla, of 0.5 to 1 millimeter in height. And how do we do that? We can influence this by changing now not the critical contour, but the subcritical contour. So here, in the subcritical contour, you push out like a little O-ring that's pushed out, and the soft tissue can actually creep up about 0.5 to 1 millimeter in height. So if we look at this case here, this tooth had to be extracted, and we see here it had a fracture in the tooth was removed, implant was placed, and the provisional was placed, and you can see that there's some problems. Now the problems here are that firstly that there is a missing papilla. There's also the mid-labial gingival margin that has receded. So what are we going to do? We're going to change this by firstly under contouring the facial critical contour, and in the subcritical contour we've added a little bit of flowable composite resin to provide a little bump in that subcritical contour. So we've under contoured the facial critical contour, and we've put a little bump on the mesial to slightly push on the soft tissue. So you can see the provisional restoration, the day of me adjusting it, I'm pushing on the soft tissue, I'm under contouring the facial critical contour, and you'll see there's the final restoration with a little bump and the contours of the restoration. So you can see the day of issue, we've seen an improvement of the aesthetics, the soft tissue aesthetics around the patient. There's some minor gingival irritation from me taking on and off, but you can see already there's been some improvement You see that now the mid-labial gingival margin around the lateral incisor has dropped down. Before it was more apical. And also you've seen the closure of the black hole that was present between the central and the lateral incisor. So there's so many surgical techniques to try and give you the best soft tissue result for our patients. But sometimes tweaking the abutment design by changing the contours, it just provides you another tool in your toolbox.